Well, thank you very much, and thank you, Mr. Schweikert, as well. I'm very pleased that these committees are finally addressing some genuine waste, fraud, and abuse. Early in the reconciliation process, I led several colleagues in urging the Republican leadership to focus on waste in the Medicare Advantage program rather than cutting coverage. While that request was unanswered, today we have an opportunity to start paving a new bipartisan path toward fiscal responsibility, a path that protects both taxpayers' hard-earned dollars and their access to care. Medicare Advantage was sold as a program to save taxpayer dollars and improve the quality of care, but I found that it is largely disadvantage, never saving taxpayers a penny and vastly outspending traditional Medicare. While some of us have differing views concerning MA and its position in the future of health care for seniors and individuals with disabilities, I know we are all concerned with wasteful overpayments and assuring the long-term promise of Medicare for future generations. The Nonpartisan Independent Medicare Payment Advisory Commission, or MedPAC, estimates that taxpayers will spend 20% more this year for people in Medicare Advantage than if they had been enrolled in traditional Medicare. That amounts to $84 billion this year alone. And these funds don't just impact Medicare's long-term finances. Every single enrollee is paying an average of $198 more in Part B premiums this year because of overpayments to MA insurers. What are consumers getting for all this money? Well, outrageously, many are just facing care delays and denials, fewer and fewer provider options, and poor consumer service. For providers, MA is becoming more trouble than it's worth. An Austin surgeon, Dr. Elizabeth Potter, was pulled out of surgery to talk to United Healthcare representatives about an authorization she'd already received for the procedure she was in the middle of performing. When she fought back, United sought to discredit her and is denying coverage for her surgery center, driving her into debt as she turns to a GoFundMe page to keep her practice afloat. Stories like hers are why I've urged the Justice Department to expand the investigation into United, to closely examine every allegation of fraud, waste, and abuse, including reported denials of necessary hospitalizations. For years, I've heard from hospitals, home health care providers, and other professionals who are experiencing increasing administrative burdens, delays in reimbursement, and smaller payments that are falling below what traditional Medicare would have paid. Together with my colleague, Dr. Murphy, we've authored the Prompt and Fair Pay Act, bipartisan legislation that we filed this week to ensure MA plans at least pay what traditional Medicare pays for covered items and services. Our bill also establishes prompt payment requirements modeled after the requirements in Part D. It has been endorsed by the National Rural Health Association, Leading Age, America's Essential Hospitals, the American Academy of Family Physicians, the American College of Physicians, and a number of others. Last month, we also filed bipartisan legislation in which Chairman Schweikert participated to address an outrageous loophole that permits Medicare Advantage plans to receive premiums and capitated payments from duly eligible veterans who receive most or sometimes all of their care through the VA. Researchers have estimated that this loophole will cost the VA over $350 billion over the next decade, as taxpayers really are paying for care twice. Once to the MA insurer, who pockets the money, and a second time to the VA, which actually delivers the care that it is wrongly prohibited from recouping its costs from the insurer. We've authored the bipartisan Guard Veterans Health Care Act to stop this waste and ensure the VA can bill MA for veterans care in the same way that they do other commercial insurers. Our bill is widely supported by the Veterans for Foreign Wars, the Medicare consumer groups, and a number of unions that serve veterans. I appreciate the support of Dr. Murphy and Chairman Schweikert in these measures, and I know they remain committed to additional bipartisan work to end waste and abuse in this program, to ensure a sustainable program for future generations, to stabilize provider payments, and improve the delivery of health care for all Medicare enrollees. I hope that this hearing will be swiftly followed by a markup on our legislation and other urgent items to take some of the disadvantage out of Medicare Advantage. Thank you, Mr. Chairman.